So Gordon, I'm going to throw it to you for starters. You know, we've had this Affordable Care Act that some people call Obamacare. You know, there was a lot of legislative language that was in place, but now things are actually starting to happen. Right. Can you give us a sense of maybe some of the high points of what's happened so far in Maine, and what maybe that means to folks at home?
Sure. We're more than 3 years into it now, and it still is very controversial across the country, very controversial with providers, but there's a lot of misinformation, and it's important for people to focus on, well, what has happened and what are the opportunities and maybe what are the missed opportunities. But sure. One of the first things that happened, of course, was the ability of kids to stay on their parents' policy till age 26. That's been very, very positive for people. Also, no cost sharing for the preventive services. So we've been working with the Maine Health Access Foundation, many other organizations, to get the word out to the medical practices and the hospitals and to the patients that now people can be, you know, called in for their regular screenings and preventive services with no co-pays and no impact on their deductibles. And
so before they come in for basic preventive services,
it might cost them $20, might cost them $40, and a lot of people couldn't afford that. So now all the preventive things, this is where, you know, a lot of the theme behind the Affordable Care Act was to put more money into primary care, put more money into prevention, and not so much at the high end. So those are all very positive things. There's also an annual wellness visit now that Medicare patients can have. So we've spent a lot of effort teaching practices how to code for those visits, and now the seniors understand they can come in once a year. It's not the same as the welcome to Medicare physical, but it's a very positive thing. So that, and from the doctor's standpoint, the increase in primary care payments for 2014 and 2015, 2013 and 2014 have been very positive. It's about $10 million to primary care physicians in Maine, and we've been trying to pay Medicaid, you know, pay for Medicaid services at Medicare rates for a decade, and in one fell swoop, the federal government has given us the money to do that for 2 years. Now, we're going to have to really work hard in 2014, make sure that continues, but those are all some of the positive things that have happened.